a lot of the times people with chiropractic care only want to get out of pain. And once they're out of pain, they stop. But there's the other part of, okay, you got into pain because of X, Y, Z, and a lot of it is lack of movement. A lot of people feel that if you're in pain, you can't move. That is a very invalid reasoning with it. And a lot of the times the reason you get pain is because we sit at desks all day long. You're on the couch watching TV. So your muscles are deteriorating. And anytime that your muscles deteriorate, you're more.
Hi, and welcome to The Holistic Entrepreneur, where we explore innovative approaches to healthcare through conversations with pioneering practitioners. I'm your host, Zane Myers. Let's dive into today's episode. Welcome to another edition of The Holistic Entrepreneur. And I've got Sheila de la Cruz here and is our guest for the day. And I've got a lot of questions to ask of you. So originally, when I went onto your LinkedIn, you had an unusual title on there. So tell me about that.
Okay, so I do medical business consulting alongside of I've had my own companies. So with the medical business consulting, what I do is I have a large range of medical professional background of where I've integrated multiple practices to be practices that do more than just one thing. So I started out with a heavy chiropractor's background, and then I started working with urgent cares that were kind of doing a different twist in healthcare. And it's very interesting because nowadays I see that a lot of facilities are trying to follow the same modules. And what it is that we did is it's making, before medicine used to be medical providers and then like the specialties were separate and they almost kind of like fought against each other, where like holistic was kind of against the medical and whatnot. So I was kind of part of the integrating where you would have facilities that would have medical professionals with chiropractic care and then implementing things like personal training and nutrition care. So if you were already sick, you kind of could come in and get treated, but then there was a preventative form towards it as well. After working for about 3 clinics there, I decided I wanted to branch out on my own. My first company was started the Health Bar. That was solely about nutrition, and then we went into peptides as well as doing preoperative clearances for surgeons. I started that first business outside of the original Monarch Athletic Club before I moved on in 2022, where I started business consulting with Under Pressure Hyperbarics, which is where I'm here now. So what I do with them is I'm integrating their practice to bring in more holistic care that are more of cash services. So then with that, I brought in the peptide therapy, the nutritional counseling, and we're kind of just we have like the whole block over on Robertson, basically, just a little bit north of Wilshire and Beverly Hills. And what we're doing here is we're really just trying to create longevity care as if you eat right, you're exercising, you are having the right supplementation, and you're checking your lab work regularly, we can keep you at optimal health so you're not getting sick. So it's more preventative care.
So it sounds like a really winning solution for the practitioners. And well, it just sounds like a winning solution because I know that I talk to a lot of independent practitioners, and sometimes they're doing pretty well, and sometimes they are struggling. Even though they may be very skilled, they may not have the marketing chops, or they may not be attracting a large contingent of people. So I just finished talking to somebody who is who provided care and had a group of practitioners together, and they really had quite a bustling business. So where are you guys in your development right now as far as, so how do you find these first, so you're kind of a new beginning business in this endeavor. So how do you find the providers that want to join together? And then once you find somebody who wants to go in on this, how do you get other businesses involved or other practitioners involved?
I think we're doing a huge change. I feel before everything used to be that everybody wanted their own business structure. And I think
hang on just 1 second. This is I'm going to start right there. So Hassan, you're going to have to edit this a little bit. So I just asked Sheila how you find the providers, both the people who are interested in joining together. And usually, wouldn't you have to have a business that's already established and then try to find other people to come in? Is that
That's
usually how it
basically
would
what
work?
I do. Yeah. So, with the clinics that I worked with, because here in Beverly Hills is such a small network of people, and a lot of referral sources kind of start to go through, and you kind of start to like get to know all the doctors within the area. And that was the beauty of me doing the business consulting first before I branched out on my own. Because one, I have a lot of doctors that I worked with where I helped them build their practice. And so that's kind of where I got a lot of the ideas from, is I kind of get like the little pieces of the things that I enjoyed that they did, and I saw that worked. So that's the beauty of it too, is I have those providers by my side. So it's almost like I'm building like a connect the dots of different physicians and facilities, and we're like kind of building a little community to bring it all together. I feel that a lot of the post pandemic, a lot of companies are realizing that community and actually kind of collaborating your practices instead of like competing with each other is what's working. And that's how I'm kind of like streamlining everything right now. Right now, with our longevity clinic, we work with multiple plastic surgeons, because with the hyperbaric oxygen therapy and the BPC 157 peptide, both of them are phenomenal for like wound care, any kind of surgery healing. It kind of expedites the process. So I do a lot of footwork of, just going to different doctors' offices, explaining what it is that I do, what the facility does, and just implementing the trust process. I like to always, my biggest part is treating the doctors, right? Because the doctors are always being used to treating other people. But I like to kind of bring them in, run them through a chamber visit, let them know what lab work is required if you're going to get peptides with us, because everything that I do is also going to be following like the best guidelines to get patients to optimal health.
So do you guys have your own lab, or do you outsource the lab? Or?
So I worked in the industry for about 16 years. I have a tremendous amount of research and whatnot. And one of the things that I realized is a lot of, insurance these days is just not covering much. You're going to have high deductibles, high copays, co-insurance and whatnot. So that's the other process, is bringing in the beauty of understanding cash pay services. What we're doing too is I've done all the research. I work with a discounted out-of-pocket lab, and it's based out of Florida. So they do very discounted labs over there. So like for $225 with us, you can get a full lipid panel and all of your hormones done for $225 with the 48-hour turnaround. So
in 48 hours, that's pretty good.
Right. Yeah. So one, you don't have to wait forever for your lab work. And then two, if you've ever ran hormones before, it can be about anywhere from $700 to like $1,000 bill. Because again, insurance is preventative care. So hormones, they don't consider to be preventative.
Right. So right now, are you primarily working within under pressure?
Primarily working within under pressure, and then I have a little side projects, like there's a chiropractor that I still assist with, and again, we play connect the dots, right? So how we already do the how I mentioned before, we work with a lot of plastic surgeons. I'm kind of building a network of, they come in for peptides, hyperbaric therapy with our clinic at under pressure, but then they're going to need some physical therapy and chiropractic care. So then I already consult another chiro clinic right now, and then I'm kind of building them into the program that when they're ready for their physical therapy, they go to the chiro. So I'm really just trying to like get all the businesses kind of working together, building referral sources, and really just making sure we're getting the patients to optimal health.
So how do you get? So I know a lot of chiropractors. I know a lot of people in all these different modalities, and a lot of physicians. Not all of them. But a lot of physicians are kind of standoffish about other holistic approaches. And I don't know what it's like in
those.
Yeah.
The fact is you're going to, in life with everything, and especially with physicians, and that's something that I think that patients need to understand. And it's not insulting any doctors. I respect every doctor, but doctors are going to further their education as far as they like. Once they get done with schooling, it's up to them if they want to specialize in anything different, right? So I do seek the physicians that are more of the holistic approach, because there are the doctors that just know to, 2 + 2 = 4, and then there's the doctors that go a little bit deeper. So I like to find the ones that go a little bit deeper, and those are very far in between. And you know that when you're going to services, because if I walk into a clinic and say peptides and they just kind of roll their eyes, then we know that that's not going to be a doctor that wants to work with us, right? But then you'll have the ones that have done their own research. They kind of geek out with you. That's just how you do it. But I am really about working with people that think outside the box, but also doing everything efficiently. Right now with the peptide world, there's a lot of physicians that are just loving the factor that you can overprice the peptides, and they're not doing any lab work. And majority of peptides are going to have hormone components in it. So that's just for me making sure that the physicians aren't just trying to make a big buck either, and finding the physicians that are more about the patient care than the money that they get in their pockets. That's the other thing too, is when you have a cash practice, it's not going to be the same kind of revenue as if you're running through insurance, especially if there's insurance coverage.
You mean the revenue is more or less?
Well, like for instance, like a hyperbaric visit is going to, if it's covered by insurance, you're going to get a lot more from the insurance company that you would from our discounted out-of-pocket services.
Right. And does the insurance company, make you charge a certain amount for when they're discounted out of pocket, so to speak?
So if you're a network, but again, that's why we work. That's where it's important to work with practices that are kind of just more of a cash base. So you don't really have to abide by the insurance guidelines. But if you are like running insurance projects, then, you do have to abide by what insurance entitles with it. And you have to charge the client what it is. So that's why I'm building these cash practices so that, and again, it's not for us to make more money. It's actually to make sure that the patient is getting quality care at a price that they can afford.
Well, it's okay to make money, though. It's always good. Everybody's got to pay bills.
Everybody has to pay bills, but I like to have everybody have a win-win situation. Peptides are not cheap. Neither are hyperbarics, right? But they are the things that are going to keep you healthy in the long run. So, we keep it at a point that we're able to keep the doors open, but that we're not straining the clients' wallets in order to keep them healthy.
So what types of practitioners would you say? Since I talked to all these people, and I know certain practitioners could really benefit from being joining forces, so to speak, with other practitioners. But right now they have their single practice and they have their specialty, or they don't have a specialty and they do all kinds of stuff. And they can't see or really never thought about bringing somebody else in to work alongside them. So what would you say to those kind of people? Let's just take an integrated medicine practitioner I'm thinking of that is in Northern California.
Okay.
That is really very progressive. He's done talks all over the world and been on major networks and so forth. But I'd say, so he's not over. Despite that, he's still not, and he's kind of become well known, but he's not, he's not overflowing with new patients. He'd like to have more new patients.
Okay.
How would you, address that kind of situation? Well, this is hypothetical, but he's
integrated practice, so like kind of just like a PCP, like primary care physician.
No, he's a chiropractor, but he takes kind of a different approach. So he doesn't. It's not a backcracker.
I love doing chiropractics and expanding them out. So the way that I always branch out chiro clinics is if he's just kind of doing the adjustments. I'm not sure if he has any modality tables or whatnot. One of the things that I've done with 2 clinics is I hired a personal trainer. I also hired someone that can do nutrition. Because not all medical providers are dipped into the nutrition component of it. And so what it builds is the preventative care aspect and more revenue to come through. A lot of people don't know how to eat these days. A lot of people don't know how to exercise these days. So that's where I would implement it, because with the chiro care, you can start charging more. because you're giving more, right? So what we would do is you would kind of do your first visit. The visit would be with the chiro. They would run through, the report of findings, seeing what the patient has going on, and then we would build a little protocol for them. And so it wouldn't just be the adjustment. So let's say the chiro needs them there like 3 times a week for 2 weeks, because a lot of times you put them on a program. You would start flowing it through with your personal trainer and with the nutrition. So, strengthening exercises, you would have the personal trainer sit there and teach them, from where they can, because a lot of them can only just do certain things like marching in place, depending on where their injury is. But what you're doing too is you're creating a program for the client for them to get like healthy, but stay healthy. A lot of the times people with chiropractic care only want to get out of pain. And once they're out of pain, they stop. But there's the other part of, okay, you got into pain because of X, Y, Z. And a lot of it is lack of movement. A lot of people feel that if you're in pain, you can't move. That is a very invalid reasoning with it. And a lot of the times the reason you get pain is because we sit at desks all day long. You're on the couch watching TV. So your muscles are deteriorating. And anytime that your muscles deteriorate, you're more prone to injury. So adding that component of a personal trainer really helps, because now you're helping the patient, and you can even build like aftercare stuff, because you can start charging for them doing any kind of programming, any kind of nutrition care. And it's not anything that's competing with your work. Because I think that that's the other thing with any kind of provider, is they don't want to feel that they bring something in that's going to take from them. You always want to make sure that what you're bringing in is adding to your program, to where you can add more, but the person's also getting more.
So how do you do all that? So I'm thinking the financial side of it. So let's say we're going through this hypothetical situation where you have a chiropractor and he's doing okay, but he would really like to grow his business a lot better. He has done some digital marketing, and some of it's worked and some of it hasn't worked. And it's always kind of frustrating, that digital marketing piece. And he's thinking about maybe getting someone else to come in, but how do the finances work? So if you're going to bring somebody in, are they an employee? Are they a partner? How does the marketing work? How does that part of the whole component work? So if this practitioner has to come out and go out of pocket to do it, a lot of them just aren't. Well, it's not like they don't have the money. They're just not prepared to do it because it's another risk.
Well, that's where it comes to where you can do both. So there's renting space. There's a lot of trainers that just need a space to kind of see a client, or someone that's I've done it where I've basically kind of collaborated already established facilities, because sometimes you have, like, especially now, there's so many people that worked from home during the pandemic, and now they don't want to, and they're trying to find like an office space, right? So there's a lot of people that are out there like that. So for instance, if you wanted to start implementing nutrition, you can be a nutritionist that already has their established clientele. And then you can do a profit share with anything that's new. So they keep theirs, but any referral source starts going to a profit share. So then that way you're not charging, or, you're not losing money. Everything becomes a gain, because now you have the marketing exposure of their clientele, and then you're adding in their services, but now you're doing a profit share. So that's one way of doing it. That would work with any kind of personal trainers, massage therapists, any like nutritionists, all that kind of goes under the same window, is like doing profit shares or renting a room. The most common that people do is they'll rent a room out. And then that way it could even just be like, hey, I'm going to charge you $1,000 to $2,000 a month for this room. You can decide if you want them to utilize your front desk or not. And then, you're making the extra money in your pocket, but then you're also getting the extra, people walking through and understanding that you're there. It's all about collaborating, working together, finding people that are in the same type of views that you have, so that you can build together.
So it sounds like a great idea, but it also sounds like it's a challenge.
It can be. It can be. Where I'm blessed is I believe that in Beverly Hills, like it's a very small community, no matter how big Los Angeles is. You kind of it's a very small town. Like, so word of mouth becomes a really big thing, so like you can depict if someone's good or not from your clinic by word of mouth, especially if they've been within the area or not. It can be challenging, but to be honest, it's a lot of fun, and it's like it's a beautiful thing when you can expand a clinic out and it works. And like in my presence of what I've seen, like, there's always tweaks that you have to do, but everything has worked very successfully thus far.
So tell me a story about a practitioner where you had a successful kind of a merging of operations or practices.
Before I branched out in my own clinic, I worked with Max Health LA, and it was just a chiropractic clinic. But by the time that I was done with it, they were doing so many beautiful services there. So they went from chiropractic care that there was a personal trainer that was added. We added a DO that did nutrition counseling. They did testosterone, so they did some hormone therapy. And by the time we were finished, we actually implemented another doctor to do ozone therapy. And then we also had a CR machine where we were starting to implement stem cell and PRP. So again, it went from one chiropractic clinic that literally it was a one-stop shop by the time that we were done.
So that sounds absolutely fabulous. I want to kind of dig into that. Is that okay if I dig into that story?
Yeah.
Okay. So, because I think that this is interesting to a lot of practitioners, or potentially interesting to a lot of practitioners, which is really your audience. You're
right.
Helping these practitioners. I'm kind of interested.
Yeah.
So when this particular chiropractor, what was the first thing that he brought in?
So we first started, so he already had his established chiro clinic. So we first brought in the trainer, and we built out an area in the back of their office because they ended up renting more space, and we put workout equipment in there. The second thing that we implemented was the medical provider. So once the medical provider came in, that's when we were able
to. Was that the DO?
Yes, and so that's when we started implementing the testosterone, and we started implementing, like we were doing trigger point injections, testosterone.
And how did you find the DO? So I'm going to interrupt you because I want to get into the nitty gritty.
Back then, because this was back in more of 2017 timing, it was really easy to kind of put the ads on Craigslist. Right now, I find a lot of the physicians off of LinkedIn. So LinkedIn is like more of today's day and age of where you find the physicians. Before Craigslist, you used to be able to get a lot off of it. So it wasn't that hard finding things off of Craigslist before. So we would, interview multiple doctors, and we kind of just wanted someone that had more of a holistic attempt and wasn't going to push medicine, because that was the thing that was very important.
So the DO is kind of a middle ground there between
right?
Between many traditional MDs and
correct.
They tend to be more open in their approach. Yeah. So when you brought them in, so you got the trainer in there, and you got some weights in the back room, and that sounds great. And then you bring the DO in. Was he actually hired, or was he brought in as a separate entity?
The company had got investors, so they were able to hire from the investor money. So they had multiple investors that kind of invested in them for them to be able to expand out. So we were able to hire the DO on board. So he was actually working for the facility.
Okay. And then was the trainer, was he also working for the facility, or was he was on his own?
He was more of an independent contractor. So he was able to bring his own clients in after 2:00, but before then he treated the chiropractic clients. And so what it would be is like, run the chiro through where they got adjusted or they didn't. And then they would have to be on the machinery. And then after machinery, they did like strengthening exercises for preventative.
Okay. And then from there, what happened?
Once we kind of got everything settled, we started bringing in more services. So I had done weight loss consulting before. And so then I implemented that, and we hired somebody on board to start doing nutritional counseling for that. And so then that got on board. And then that was bringing somebody in that already had their clientele. So she came in with their clientele and did a profit share. So, again, it wasn't at a cost for the company. They just kind of had to give up one of their rooms, but then they were profiting. think they were profiting 75% of the profits of the nutritionist because she needed the license of the physician in order to run her clinic.
Right. Yes. So the
That's kind of
DO
where
is
you come in. I like to kind of connect the dots of like, here's this person and here's this person. They both need the same thing. You know what I mean? And then just kind of connecting it so it works.
right. So she would take all the vitals
She did everything. So like, it was just that the physician was there and they had to be present through during the visit, and they had to kind of come in through like follow-up appointments. But, she was basically practicing under the license and being supervised under the license
right.
of that physician in-house.
He was the one who had to sign off on the script.
Yes, he had to sign off on anything. Like he had to review the labs.
Yep. Yep. That's an interesting. I do know someone else who is a nurse practitioner.
Mm-hmm. Well, nurse practitioners are doing really well now too, since they, made it that they can practice on their own with specific things. So getting an NP in your clinic is key. Like just even adding simple little things like vitamin injections, IV therapy. Those are all things that kind of keep the practice going, because like sometimes insurance takes forever to pay out, so like you always kind of want to have your cash practices that pay your rent while you're waiting for money.
Mm-hmm. So what does that practice do now? That the one that we just kind of ran through, they do the physical therapy, the DO,
Yep. So they have a CR machine. So they do PRP and stem cell injections. And with the CR machine, you're able to get it right in the area because it's like showing, where you can inject to. They did weight loss. Yeah. So when I left there, one of the last things they were doing is they were doing brain testing. And the brain testing was just kind of more of implementing if people are on the right type of medications. It shows you, colored schemes of if it's anxiety, ADHD, like what may be the reasoning that the malfunction of the brain is going on. So really proud of the clinic, still keep in contact with the owners. And that's the beautiful thing is I'm still in contact with a lot of people that I worked with. And that's kind of, they help us, like we all kind of work together, assisting each other and streaming things along. Like there's physicians that I still reach out to if you just need more advice on peptides or, like labs or hormones. We all work together as a community. This is a beautiful thing.
So what's next?
Keep growing. I really want, with Under Pressure, we're looking to expand. So that's kind of part of it. We're right now they're going to be expanding at a different surgery center that focuses on, women with breast cancer. Mm-hmm. And so Fabulous. We're expanding with that right now. But just keep moving it forward. We're hoping to move something to the South Bay. So this is just the beginning, and I'm here to help any physician. Like I do consulting on the side, there's people that I even just consult of just knowing that we're all looking for the best for humankind in general. There's a lot of preservatives and stuff in the food, and we have lost sight of what's healthy for us in general. And I just kind of want to go back to the simple of if you eat right, you exercise, you get some sunlight, you're hydrated, you're going to be healthy for a long time.
Yep. Let's hope so.
Let's hope
try
so.
to.
Try to. We do our best.
So, I mean, yeah, it's the eating is a big part of it. So
it's very interesting too, because depending where people come from, like the idea of what's considered to be healthy, it ranges, So a lot of the times too, even when I'm doing consulting with the nutrition or the peptides, I ask people to send me photos because their idea of portion control or what they put in their mouth is going to be completely different than what the photo will expose.
So right now you're just mainly in Beverly Hills area. Do you have aspirations to grow out?
Yes, I'm hoping to grow out. I'm from Arizona originally, so looking to expand out there. I know we're working with other physicians as well to like expand their practices out, especially with the hyperbaric chambers and the peptides. They kind of really can go with any clinic where it's not competing with each other. So there's a Miami location we're looking into that we would implement with another facility, that has their own stuff. So I think right now is collaborating with other places where we can just make another facility bigger and better with what we provide.
So, who would be your ideal client? So, let's say you are you as like a kind of like an anchor. I think you'd probably be looking for an anchor kind of practice,
Right.
and then helping them. This is in my own mind. Correct me if I'm getting this wrong.
Okay.
And then helping them to build out beyond that, so that they could really grow, but stay in place.
Right. Who would be the ideal client for that?
Mm-hmm.
I like working with DOs. I like working with holistic medicine doctors that are kind of more into like not pushing meds. I do believe that meds are needed. However, I feel that they're overused. My mom, for example, had came out here for like a week, and I ran her labs here in our clinic, and she's on 2 medications at 72 years old that I looked at, and nutrition counseling would have made it that she wouldn't have been on any of those meds. So I don't want to work with like medical providers that just want to solve the answer with a pill. I want to work with clinics that want to expand out, because there's just so much more in holistic care than just, again, giving a blood pressure medication, or, especially when you can work on somebody's like diet or exercise as opposed to pushing the meds.
So a DO or someone in a holistic sort of practice who would have an existing facility that could be expanded or has additional space. I'm just trying to think of,
Right.
and correct me as I'm going along here. Then and then somebody who's not necessarily a pill pusher per se.
Right.
And then from there showing him the De La Cruz way of growing their practice through collaboration.
Correct. And there's a lot of them out there. Like, to be honest, right now, I'm very happy. I'm working with a lot of clinics right now. We're making a lot of moves, and I know it's just the beginning, and we're just gonna continue to get better and better. And what I do see in today's society is people are more willing to work collaboratively with each other than we used to in the past. In the past it was always competition, and now it's just like, I think I have at least 6 different facilities that send me clientele that are all within the area, where they could even see the clients too if they wanted to, but they just know that we might give a little bit more TLC with the care.
Or they're just booked up, or they don't have the ability to take the people, and so
completely.
Yeah, that is historically been not the norm.
No.
Where they want to send somebody
Right.
somewhere else.
Exactly. But now it's happening, especially because if you build a good relationship and rapport with physicians, and that's what we do too, is whenever a physician refers anybody to us, we make sure that the client knows that they're your physician. We're abiding by what they want, and we work hand in hand with the physician so they don't feel that we're taking their clientele.
So how do you do your marketing now? Or what kind of marketing are you doing? Besides,
marketing has changed a lot. A lot of the times it's a lot of foot traffic. I'm still doing the foot traffic. It's like really what it's come down to at this point is building relations. You got to keep popping in time to time. You can't take no for an answer. Don't be pushy. You know what I mean? But just checking in and making relations with facilities. So a lot of times I'll kind of go in, bring pamphlets, bring some coffee, get to know their front desk staff, get to know patient care coordinators or managers, like build rapport with the offices. The more people know you, the more they can trust you, and the more that they'll send the care over. So that's the marketing that's worked. Social media helps a bit, collaborating a lot of the stuff, but it's like, again, the algorithm of things. But building, I'm doing a lot of like health wellness mixers. That's a good way of collaborating, because then you kind of bring all the physicians all under one roof, and everybody gets to kind of meet and greet, and then really have some time to really discuss what it is that each individual does. And then, you can exchange information if you feel that it's something that can work hand in hand with each other.
So give me an idea of a social mixer, a medical social mixer.
So I am actually having one here on the 31st for anyone that's in the Los Angeles, Beverly Hills area. So again, how we want to collaborate and like show different people, different ways of being healthy. The way that I'm hosting this one is it's going to be here at Under Pressure. So we do IVs, peptides, red light therapy, and hyperbarics. I brought in a chiropractor who does like laser therapy, chiropractic adjustments. So he's actually going to come here with his massage therapist and his laser gun to kind of like basically do some consultations and run some laser on people that need it. I have a supplement brand that's coming in to bring in creatine and like protein powder. We have an aftercare for surgery service that's going to be here. And then we also, I'm bringing like little fun stuff like a tarot reader, just because everybody in LA likes to kind of do like the astrology and tarot reading. And then lastly, because again, it's not just about eating, you know what I mean? And like the chambers and the peptides, but it's also the exercise. So we have a client of ours that owns a gym that's called Lobo's Boxing Facility. And they're going to come in and they're going to be conducting like stretching and shadow boxing. So it's going to be like a 4-hour event from 10 to 2 on a Saturday. And just kind of everybody can do some test dives in the chambers. They can get little mini consultations from the peptides or the chiro. And then they get to be active with the boxing community.
That's really commendable. So how do you market that? So you're it's not just physicians. You're talking about bringing people in off the street that are.
That's where you get your clientele. So like if you think about it for the boxing gym, that was what I wanted to emphasize because we do the chambers. So we work with a lot of athletes that, you know, they have a torn ACL, they got the concussions, and that's what the chambers assist with. So that's why I wanted to target. Right now I'm targeting more than just physicians' offices. If you're going to a gym, you probably care about your health. So that's why I'm kind of targeting more of like the gyms and like active areas because I want to target people that are already concerned about their health that just want to take it up a notch. Yeah.
And are they generally open to the gym owners? Are they generally open to the concept?
Oh, they love it, especially too because they like going into the chambers. So this all kind of started with one of the clients doing the chambers because he tore his ACL and he's recovered so fast from it. So he believes in it and wants more people to know about it. And that's kind of how we got the idea to streamline it with this boxing gym specifically.
Well, I know I was in healthcare for many years, medical devices, and I knew that hyperbaric chambers have been used for a long time in hospitals for wound care. And it's just a well-known, faster way to.
Chambers have saved so many people, and the hospital grade ones, because we know that there's, stress chambers and the ones that aren't the hospital grade that don't get to the higher ATA. But like how we mentioned, we have the hospital grade that get to the 2 to 3 atmosphere. So that's the highest level of air that you can get up to. Sorry, I totally lost my train of thought with that one. We can edit that out, right?
We're talking about, I was talking about wound care in hospitals.
Oh, right. So, the wound care. Oh, okay. So what has been really great with the chambers that we discovered post-COVID is it really helps with the brain fog and the inflammation that COVID caused. So like it became even a fad for people to do about 10 to 20 visits in the chamber to clear anything that you had for lingering COVID side effects.
So I can see how that would make sense. Mm-hmm. So how much does it cost for whatever a visit and you're going to go into the hyperbaric chamber?
So with the hyperbaric chamber, the way that it works is if you're going to do one single session, the lower grade session is going to be 60 minutes. That starts at $350. We start packages anywhere starting as low as 5, going up to 20 plus. The more you buy, the more that you save as far as because we do percentage discounts for the packages. But then there's also our longevity package. So if you wanted to come in and get peptides IV, and then like a few chambers, like, once or twice a week, we have those too. So, they get cheap, like the more you buy, the cheaper everything gets, but the max amount you'd spend would be $350 for an hour. One thing I want people to remind with the chambers too is you go inside the chamber for an hour, whether you're going for an injury or, COVID or like what the issue may be, the chamber is still revamping your entire body.
Right.
Yeah.
Yep. So, so it sounds like you really could, make this into a pretty good enterprise,
for sure.
and has a lot of opportunity beyond where you are right now. And I think we've about covered it. I really appreciate you coming on the podcast.
Thank
Anything
you.
else that you want to add on?
The only thing I want to add on to people is preventative care is the key. Make sure that you're running lab work at least once a year. Make sure that when you're working with providers, that if you're doing any type of medication or any kind of supplementation, whether it be peptides or whatever it is, know that it takes 3 months for your lab work to move. So make sure that you're checking stuff every 3 months. One of the most common thing I realize that a lot of clientele does is they'll work with a holistic doctor or a nutritionist, and they'll get on all these supplements, and then they'll come to me and it'll be 2 years and they just never got off it, but there's always minor tweaks that you need to do with stuff. So just make sure you're staying on top of your game, and getting your lab work once a year is very crucial because you can really stop things before they become a big issue.
Well, that about winds it up for today. Thanks for tuning in to The Holistic Entrepreneur. I'm Zane Myers. If you enjoyed this episode, subscribe to our podcast or watch on YouTube. Join us next time as we continue to explore both the art of healing and the science of business in healthcare. We'll see you next time.